Welcome, listeners, to Diversion Insights. My guest today is Dave Thompson, the president of Wicklander-Zulawski and Associates. Dave is a certified forensic interviewer, and in the past, he actually participated in diversion investigations for a large retail pharmacy chain. So he has experience in the specific area of diversion of controlled substances by healthcare professionals. Dave, welcome.
Thanks for having me. Definitely a topic I'm excited to ramble on about for as long as
that's good. Good. Give the listeners a little bit of your background and then what ultimately brought you to WZ.
Wicklander-Zulawski, we've been around for over 40 years at this point. So we're really at the core, we're an investigative interview training organization. And I think what's really neat for your listeners, and what we'll talk about today, is these interviewing skills and methods really apply across so many different factors and sectors in life. And so our client base ranges from pharmacy and healthcare professionals all the way to federal law enforcement and everything in between. And my experience kind of ranges in the same. So I've spent some time, as you mentioned, as a practitioner doing a lot of drug diversion investigations. I also did work in the private sector on just kind of your standard theft, fraud, embezzlement cases, employee relations investigations. Spent a little bit of time in the law enforcement space, but really majority of my career has been in the private sector conducting interviews and investigations, which brought me to WZ a little over a decade ago. And now I get to be one of our instructors, which is one of the favorite parts of my job, is to go out there and conduct training to help investigators become more efficient and confident in what they're doing every day.
Yeah, I bet that would be fun. I bet I would like that too, if I ever get skilled enough to do it.
Well, I'm sure you are. It's neat to be able to see those skills as you do, right? When you get to go out and consult and work with organizations and pass on that skill set and see people kind of flourish in their careers is a neat thing.
Definitely. Well, interviewing is the area where you have the deep expertise. So I am really here to learn from you and let you guide us through what is important. So I will kickstart us with a question. Does interviewing a healthcare professional suspected of diversion because they have a substance use disorder utilize the same type of interviewing technique as someone suspected for diversion for resale? I'm assuming as you go into an interview, you kind of know based on the quantities that are missing. Maybe that's my first assumption, but it's different, right? I mean, I would think that a healthcare professional that is stealing, diverting for resale, that's just stuff like anything else out there. Whereas if they've got a substance use disorder, it's still theft, but now you're dealing with a disease and all kinds of other stuff, right?
I think that's a great question. And there's a lot of things to unpack there. In the beginning, if we back up, is really identifying what is your goal of that conversation, right? And it might be different based on your role in the investigative process, right? If you're looking at this from more of a criminal or a law enforcement perspective, and you're trying to determine what's the scope of a case, right? Interviewing somebody where there's resale, there may be an interest not just in getting somebody to acknowledge that they're involved in the theft and the distribution, but also who are they distributing to? Because maybe if there's a problem at your hospital or your pharmacy, and maybe you've identified one pharmacist or a technician or whatever who's involved in this behavior, even if you solve that problem and you do that investigation, but there's still somebody else out there who's motivating others to steal and resell, that problem might not go away, right? So it's depending on your goal of the interview, you're going to strategize each of these differently. So am I just looking for identification of what happened, or am I looking for a more developed admission and development of other details? I might also want to look at what types of controls are in place or not in place, or what are in place are not being followed, that we can help prevent this, going further. So I think the first thing is let's look at these different types of cases and what is our goal of each. If you're looking at somebody, as you mentioned, who has a substance abuse problem, I think we're also looking at taking care of the employee to the best of our ability, right? And within the responsibility of your organization. But those are other things to think about. Do we partner with an employee assistance program? Do we have any other support for that person after the interview is complete, after the investigation is complete? And the last thing off the top of my head I'm thinking is, being aware that if you're interviewing somebody who's also under the influence or maybe has a history of that, what types of behaviors maybe we are misreading during the interview that we're assuming mean guilt or deception or honesty or out of place or whatever it might mean, but it's actually as a result of some other type of risk factor, some other type of being under the influence. And so it's being aware of what is the context of that situation. What does that person have to lose versus maybe somebody on the resale side? So I think it's a good question, and it really applies to a bigger issue of not every interview is the same, and not every interview should be approached with the same exact steps in the conversation.
Yeah, most definitely. All right, so let's make our focus on the one with a substance use disorder. And let's talk about, you mentioned behaviors during the interview that might not be deception, and might be because they're impaired at the moment. So elaborate on that.
Yeah, I think and we've talked about this before, one of the myths, I guess, whether you're an investigator or just a lay person who talks to any other people in your everyday life, is we all think we can identify when somebody's lying to us, right? Whether we grew up with this natural instinct, gut feeling, because our friends, family, significant others, whoever, coworkers have lied, and you start to kind of develop this, okay, every time, somebody looks to the left and then avoids eye contact, or they're fidgety or whatever, they turn blush in the face, we've conditioned ourselves that those are signs of deception. The research doesn't necessarily support that. Now it could be, right? That could be somebody who's lying to us. It could also be somebody who's just uncomfortable. It could be somebody who maybe they're not involved directly in whatever the allegations are, but maybe they're the one responsible for not locking the safe cabinet that has the C2s in it, or they're the person who falsified an audit or got lazy, which allowed somebody else to commit a crime, right? There's so many different things that can impact somebody's behavior. And to your example, if you're especially talking to somebody who is either under the influence, we could even be talking to somebody who has maybe a limited intellectual capacity. Maybe they've got exposure or experience with the trauma, and maybe they're re-triggered during the conversation. It's a lot of different variables that could impact somebody's physical or verbal behavior that then we just think, because we've grown up conditioning ourselves, that this means it's a lie. This means somebody's not telling us the truth. And we start to kind of go down that path. So behavior is important to pay attention to in a conversation, right? If any of your listeners have had conversations at a holiday party or a networking event where you can tell when you're just done talking to somebody, right? And you start to kind of shift your eyes and your body language. So communication is important when it comes to both verbal and nonverbal. But when you're dealing, especially with somebody with these variables, we got to be careful classifying people as deceptive based off physical behavior.
Okay. Do you have any thoughts on how to assess at the very beginning what you're dealing with? You've mentioned trauma, triggered some trauma, possible impairment. Can you do that at the beginning, or does this just take some time during the interview process to sort it out?
Yeah, it's a good question. And that's one that actually gets debated often in the investigative space, because not every investigator is a clinician. Not every investigator can be expected to diagnose somebody with, whether it's somebody who's under the influence or special needs or has some type of kind of traumatic incident that's gonna trigger. So there's a lot right now going on in the field of investigative interviewing to try to educate investigators on what are some things you can be aware of in the beginning of an interview, or even before you set foot in that room, to identify, hey, this person might have some dispositional risk factors that maybe we're aware of. Now, it's interesting in the private sector versus the public sector, especially in healthcare, when you have things like HIPAA that might prevent an investigator from knowing about certain backgrounds or issues that somebody's dealing with. Where sometimes in the public sector, you might have a little bit more, when I say public sector, I'm referring to like a law enforcement investigation, you might have more visibility to somebody's, maybe they're in school and they're on an IEP, or they're on some type of educational plan that demonstrates they've got some kind of cognitive impairment, or they struggle with the written language, whatever it might be. And so there's a difference in what kind of access we have beforehand. I think this sounds very simple and elementary feedback and suggestion, but in the beginning of an interview is making sure you're allowing somebody else to talk and we're not just dominating the conversation. A lot of times interviewers walk in nervous, often scripted, and they've got maybe a preamble of some sort, which might be okay, but to an extent, what are you receiving from the interviewee if all you're doing is talking. And so in that initial kind of engagement is making sure we're actually developing rapport in a way that we can start to get an understanding, hey, this person seems nervous or off, or they're struggling with some really basic questions right now. And that might help us understand that there's a bigger issue at play if I'm not even talking about the primary incident yet.
Okay. All right. That was a great lead into the building rapport. How do you do that? Building that rapport at the beginning. That has always felt a little awkward to me. Not knowing, maybe don't introduce myself with some crazy title that would be
Right.
like, I am the diversion specialist. It's like,
Right.
let's not call me that. And then developing that rapport. One, quite honestly, I'm not great at small talk. So to come up with some random questions feels very uncomfortable for me as the interviewer. And I don't think, if I were sitting in the other chair, I'd be like, what's your deal? Get on with it. You don't care about what I did yesterday or, whatever it is. So let's talk about how we can build rapport.
Yeah. Rapport is more than what people classify it as, right? Like you mentioned small talk. I think a lot of people think, all right, I have to go to a meeting or I got to go to a party or whatever. I have to develop rapport with people. And that means like you and I did, let's talk about the weather. Let's talk about the football game last night, or let's talk about whatever's going on at work if we happen to work together. And that can be that small talk piece is what's known as like the similarity principle. What are things that we might have in common, which could be, what's ever going on in the world, in the political climate or in the news, or we're both dealing with bad weather, or we're both dealing with being overworked. And so that's one concept of rapport. But the other is more evidence-based approaches to rapport, which include things like being transparent, right? Like letting somebody know to the extent that you can what the process looks like, what the conversation might look like. And it doesn't mean here are the 15 questions I'm going to ask you. But if you think about from a transparency standpoint, if anybody's ever had to go have surgery and you go in for outpatient procedure or whatever, and you don't just get sent to the operating room and they start cutting you up and doing the thing, right? Is first you're going to probably go to the waiting room, then you go to a smaller waiting room, and you're going to be met with the anesthesiologist and the nurse and the doctor and the surgeon and probably the recovery nurse. And they're going to tell you, here's everything that's going to happen to you throughout the day. And by having that knowledge of what's going on or what's about to happen, and they're transparent, you feel a little bit more confidence in the conversation. And even waiting isn't as bad when people are transparent, right? If you think about like calling a customer service hotline for whatever, your cable company or whatever it might be, we just get told, hey, let me put you on hold. I'll be back with you in a minute. And you got to listen to that elevator music playing in the background, and you're not sure how much longer they're going to be. Do they forget about me? But if somebody's transparent and they say, I'm going to put you on hold for a few minutes, I need to go do whatever. I need to go look up your account to verify something. I'll be back with you in like 3 to 5 minutes. If it takes longer than that, I'll come back to check in. You have more confidence in what that person's doing, and you feel like you're a part of the solution. And so in an investigation, right, you're not going to tell somebody everything that you're about to do. But if we can find small ways to be transparent during the process, can help develop rapport. And we can dive into these, but there's really these principles of being honest, being transparent, being empathetic, and empowering or giving autonomy to the person that you're interviewing. Because a lot of times they don't feel like they have any choice, right? They're being told to come in the office, being told to sit down, and now they feel like they have to do what they're being told to do. And we're less likely to give truthful information when we're being compliant versus being cooperative. And so there's a lot more to it than just small talk that we could probably dive into.
Okay, so let's run a quick scenario then. Let's assume that your lead interviewer is the diversion specialist. That's their title. And they are a healthcare professional. You've got in the room with you, maybe it's HR is theirs, maybe we're going to interview a nurse. Maybe we've got the nurse manager, maybe not, but there's definitely somebody else in the room with you. So there'd be at least 3 of you, which includes the person you're interviewing. The reason we have them there is because there has been an audit completed on their controlled substance transactions that leads us to believe that there might be some diversion going on. The data just speaks to us that way, whether it's, lots of wastes that they remove it and then they just waste it, they don't administer it, or if it's they dispense maybe, twice as much, 3 times as much as their closest peer, one of those types of things. The data is just telling you that something is off. And it might even be, as I mentioned to you before we started recording, is sometimes it's like really clear, like, and then most of the time though, it's like, this is off. It's different. We need to figure out what is going on here, because it might be practice, but it might also be diversion. So that's the person we're bringing into the room. Give me an opening that we could use that would be transparent without going into, too much detail that would be appropriate.
Okay, I like that. So a few different things that popped in my head as you're talking. First, when you think about the role of the interviewer, when we introduce ourselves, and you mentioned this a little bit earlier, we have to be aware of what words that we're using in the introduction of anything, whether it's even telling somebody, hey, we're going to go have a conversation, or what word are we using to define what this meeting is about. And what I mean by that is if you have somebody who comes in, and I've had this before, where maybe I am having an interview with somebody and I'm asking their manager to bring them into a conference room or whatever. And when that manager, that person that you're relying on says, hey, Terry, can you come in the back? Dave, we've got an interview scheduled with you and Dave. What, an interview? What did am I getting promoted? What do you mean an interview? Or Dave wants to talk to you about an investigation or an audit, as you mentioned. Those words are going to start to trigger, what did I do wrong? What consequences are at play here? How do I protect myself and defend what I did? Versus a word like conversation or discussion or meeting. So just being aware of even how this is introduced before they walk in the room.
Good
now
point.
When I'm introducing, myself or the people in the room, if you mentioned this a minute ago, but if I'm going to introduce myself as the Superman of drug diversion investigations and theft and fraud, those are scary things to talk about. Now, I don't want to lie, right? I don't want to obviously be somebody that I'm not, but I don't necessarily need to highlight words like theft, fraud, diversion in the first 30 seconds of the conversation, right? Again, when I say I'm here, even if think about this from like a human resources standpoint, if I walk into an investigation and say, I'm a human resources investigator, and I look into things like sexual harassment, discrimination, and fraud cases. Well, if that person has been acting inappropriately, they might not have identified that as discrimination in that example, but now in their head, they're thinking what they did was discriminatory. Now there's a consequence. And if there's a consequence, I have a reason to be resistant. And so it's the same thing in your example. If I start to label things that maybe were done intentionally or maybe not, maybe it was ignorance or negligence, or maybe it was intentional, I gotta be careful what words I use that define that. The other couple things, I think thanking somebody for their time is important. Acknowledging the fact, regardless of how you might feel about that person, right? Maybe you've been investigating them for weeks, months, whatever it is. Maybe you're frustrated because we all carry biases and emotions into the interview. And when you walk in that room, it can be hard to sometimes just see that person as a person. And so acknowledging the fact that, you just took them away from whatever they were working on that day, or took them away from maybe patients or customers or other coworkers. But say, hey, Terry, thanks for coming in and spending some time with me today. We're going to try to get through some of the questions in our conversation in a short amount of time, but I just appreciate you sitting down and talking with me. Even just acknowledging somebody's time also kind of creates this, feels like a debt that you now have to pay me, right? If I'm thanking you for your time, you haven't even given me your time yet. It almost feels like now you have to give me the time that you just got thanked for, right? Hey, thanks for being cooperative with me today. Thanks for answering some of the questions that we're about to go through, right? Acknowledging somebody's time and patience. And the last thing, go ahead.
Does that work? Sorry, don't lose your train of thought. Does that work even when they don't have a choice? I mean, their manager is like, you have to come with me.
Yeah, because I think they do have a choice at the end of the day, right? I mean, it may not feel like somebody has a choice, because if they say, no, I'm not going back with you, there's probably going to be some type of consequence for that, insubordination. Hey, this is part of your job. But I think, still acknowledge, I'll give you a quick example of this. I was talking to some detectives a couple of years ago now in a major city in the West that were working on gang related cases in the prisons. They're interviewing inmates that are affiliated with different gangs to try to do more like intel briefings and figure out what might be going on that we should know about, that we can proactively maybe prevent some crime. And so they're talking to people who are incarcerated. When you would think about, hey, I need to talk to Dave in room 102, and he's being brought to that room and being interviewed, you don't feel like they have a choice, but they do, right? It's still their time, it's still their emotional energy to have that conversation. And so even just thanking somebody, it's not necessarily I thank you for your time and all of a sudden you're going to give me an hour of your time, but it's the humane part of the conversation and treating everybody as we're all people, all of our time is equally important. So thanks for giving me some of that today, even if they felt like they didn't have a choice. So if I thanked you for giving me some time, you say, well, I didn't have a chance anyway. My boss told me I had to come back here, right? Well, how do we respond to those things that helps develop and maintain rapport? Because some interviewers, especially egotistical interviewers or sometimes newer interviewers, don't know how to respond to that. So thanks for giving me your time. You say, well, I didn't have a choice. I was told to come back here. Well, hey, I'm sorry if you got made feel that way. We just want to make sure that we hear everything directly from you before we just make any assumptions about whatever it might be. Or, hey, we know you've been around for a few years and you're somebody a lot of people look up to in this department for training and onboarding. So I thought you'd be the best person to talk to. We'll make sure to get you back as soon as possible. Right. And it's acknowledging their concern versus trying to overpower and use our force or our position in that space.
Okay.
The only other quick thing I was going to say, because you mentioned what the room looked like, right? Meaning that this person's coming in, they've got investigator that maybe they've interacted with before, maybe not, but maybe they identify that person as the auditor or the terminator or the disciplinarian or whatever that perception is. Maybe you've got a manager in there. Maybe you have a human resource, employee relations type. But there's all these different players as you start to kind of reference who could be in the room. We should also understand what is going through that person's head, the interviewee, when they walk into a room and they see the people in that room, they see the players in that room. And we need to understand that innocent or guilty, right, whether it's intentional or not, there's a lot of fear probably when somebody walks in that room, a lot of unknown. And if our goal is to get as much information as possible, people are more likely to give you reliable information when they feel trusted and safe and comfortable. And so even acknowledging the fact that, hey, I know the three of us are in this room, or we've got Sarah here. She's just here to take some notes for me. The conversation's really just going to be between you and I. We're going to keep everything on a need to know basis or whatever, depending on the context of your case that you're permitted to say. But if somebody has a fear of who's going to find out about this, well, let's proactively try to reduce that fear by sharing with them this kind of need to know basis or confidentiality. If somebody is worried about, well, who's going to know that we're back here? Or maybe that's the reason, hey, just so you know, we wanted to talk to you in this meeting room because we didn't have to want to have you walk out in front of the entire department and have a bunch of people ask you questions. We want to make sure we can have a conversation back here and not bother anybody else. But whatever we can say to help inform the person as much as we can and with transparency about what the situation looks like and try to address some of those fears. Our goal is to make somebody feel comfortable so we can get reliable information.
Okay, that makes sense. Yeah, so it's almost like a lot of the things that the group discusses prior to the interview and the reasons you're doing things, like even the script of how to get them there and then why you're picking the room and everything. Some of that in a different language is okay to share with them. We've put this thought into it, and this is why we're doing it. For your privacy, we just want to get to the bottom of, what we're seeing, give you the opportunity, don't want to make assumptions.
Right. And your example, if we're following up post audit, and so we don't know, right? Did this person commit fraud, commit drug diversion? Were they just lazy? Were they not trained the right way? We may not know that answer if it's not easily clear to us.
Right.
So maybe the way that we go about the interview is in kind of a strategic path where we're asking some questions that might be our high level about their training and their onboarding and their day-to-day, and we'll slowly get more to the specific issue. So to an extent, we can share some of that in the beginning. Say, we're going to ask you a lot of questions today because you've been here for a few years, and so we know you're kind of the resident expert on X, right? Whatever it might be. And so I just want to kind of get an understanding of how things operate day to day here, so we can make sure we're replicating that throughout the whole organization or whatever. Or you've been here for 6 months, so we know that you're somebody who's recently gone through our training and our onboarding. So we thought you'd be the right person to talk to about how X, Y, and Z process works. So we're going to ask you a few questions just to kind of get an understanding of what the day-to-day looks like here. And so that's all truthful information. It alleviates a little bit of the what is this about type concerns. And last thing I'll say is, like, as we're thinking about preparing and how do we enter the conversation, think about a job interview, right? If you have somebody coming in that you might hire as a candidate interview, you want to hire this person on your team, you're probably not going to start right away with just the first question. Is you're doing the same thing as we're trying to, hey, you know what, how was your drive in? Did you find parking okay? Those kind of things, the small talk like you talked about a minute ago. Maybe there's a little bit of some rapport, but there's also transparency often in a job interview. They say, you're going to talk to me today, and then after this conversation, we'll probably, you'll hear from us another week or two, and we'll set you up with somebody from human resources. It's the same concept. We just feel like in an investigative interview, I think there's this kind of this assumption that we need to come in with more authority and be more in direct command of the conversation, versus realize my goal is just to get as much information as possible. And hopefully that helps me prove or disprove my investigation. Let's make sure people feel comfortable in the process.
Okay, that makes sense. If we are going to start with those general questions at the beginning, and I'm going to ask you some general questions about process and what have you, and then we know that then we're going to get into a little bit more specifics about, this is what you did. And there's various camps. Some people like to bring out the entire audit and go transaction by transaction. I don't prefer that. I prefer more of a general approach. Would you, excuse me, give that in and then we're going to do this, and then we're going to do this? Or would you we're going to start with this?
Yeah, I don't think I'd be specific unless for some reason, based off the nature of your case or your in the criminal and the law enforcement space, depending on the case, that might have to be a little bit more specific in the beginning. But in general terms, I would keep it general, right? Because if my goal is try to determine somebody's actual knowledge of a policy or a procedure, right? And if they're smart and they're doing something they're not supposed to be doing, right? So if they're intentionally leaving a safe open, if they're intentionally falsifying counts on an inventory log, or they're intentional, whatever it might be, when you ask them about policy, they're of course not going to voluntarily say, well, yeah, we're supposed to do this, knowingly that they're doing the other thing, right? An intelligent, deceitful person would say something like, well, I've never been trained to do it that way, or that's how we've always done it, or I thought that was okay, that's what my manager told me to do. And so in the beginning of the interview, if you say, hey, we're going to ask you about this, and we're going to specifically ask you about this, the whole time to think, okay, what did I do wrong there? How can I excuse it? So typically I would say, we're going to just ask you kind of some general questions about day-to-day here at the hospital or here at the pharmacy or whatever, just so we can have a better idea of what things look like out in the field. So why don't you just tell me a little bit about like what your typical day looks like? And I might start that high level. And my goal, when I used to work in the field, especially doing investigations with pharmacists, I'm not a pharmacist. I'm not a clinician. I couldn't pronounce half of the names of the drugs that they're stealing in the first place. They could talk in miles above my head about how billing worked and government coupons and Medicaid and Medicare, and 5 patients come in, they all pay different for the same exact product. Like, that was all kind of foreign to me. And so this process of an interview, and there's some different names for it. There's a strategic use of evidence. We have a method called the participatory method. So the person's participating in the conversation. But this type of interview where you're allowing somebody to kind of inform you or educate you about what their day-to-day is great when you're interviewing somebody with an ego or a narcissist or somebody who likes to prove to you that they know everything. Because the more that they talk, essentially the more information they're giving you and the more they might implicate themselves in doing something wrong. So you have to be strategic in the way you do it, because the goal is really to get the truth and get reliable information. But the best way to do that is to let the other person talk. Okay,
that makes sense. Yeah. Let's talk about that with your experience at in the retail space, pharmacy space. Is interviewing healthcare professionals different. Now it is, if there's a knowledge gap, right, you need them to teach you, and it's maybe you learned, I'm sure, over time what was right and not right. But in general, I mean, the healthcare professional theoretically is intelligent and they know what they're talking about. And so would you say it's different interviewing somebody, a professional like that, as opposed to, do you handle it a little bit differently?
Yeah, I think whenever you're interviewing somebody who has a subject matter expertise, whether it's in healthcare or, in today's world of AI or IT or any kind of like crypto
Specialty.
fraud, right?
Yeah, right. Yeah.
That's above my. I just had a podcast about this kind of crazy crypto scam that half of what we talked about, I have no idea. And so the investigators have to really understand just as much as the in that case, at least a criminal was conducting this operation. And so, yeah, I think anytime you're interviewing somebody who's doing anything in a field you're not an expert in, you have to approach it a little bit differently. It doesn't necessarily, there's two things at play here, right? It's the context of what they're doing doesn't necessarily mean that person is intelligent or smarter than you, whatever it might be, but they have an area of knowledge that they're more experienced in. Sure. It could even be interviewing the cashier at a retail store who knows how to work that register better than anybody else. And they might know how to manipulate voids and refund frauds and change prices because they're spending 8 hours a day on that system. And so anytime you're going to, and I've had this plenty of times in my career where I have been educated by the interviewee on how to commit fraud because there are ways that I had not seen before or thought of before. And so I think one of the challenges I had interviewing in the healthcare space is not only was I not an expert in the day-to-day, but then also having that clinical knowledge, which you don't necessarily need, but not fully understanding simple things, right? Like all the generics that did the same thing as a brand name and how prices could be different from what will call looks like and how insurance fraud works in that space. Understanding how easy it is in the robots that are dispensing scripts, maintenance medication, how easy, and I put that in air quotes if you're just listening, but how easy it is for sometimes those to be manipulated on what we're putting in each bin or be miscounted, how inventory worked in that space. So there's a lot in any profession when somebody does it 8 hours a day, or for some pharmacists, 10 to 12 hours a day, a few days a week. They know the day-to-day better than you, which means they also know how to take advantage of it better than you. So yeah, that takes some work. One of the things that I always leveraged was actual subject matter experts to either assist in the preparation of the interview and or maybe be in the room during the interview. And I think both are equally important before the interview. So if I could talk to somebody like you before an investigation and say, hey, I've got this case where I've got a bunch of controlled substances missing or whatever it might be, and I'm talking to pharmacist, Susie at this hospital, and here's her role and here's what she has access to. What are different ways she could be doing this? What's going on? What does her day-to-day look like? You might be able to give me knowledge about things I'm not even thinking about asking her, right? That could be helpful. The other benefit is then if I have you in the room as a witness to the conversation or a note taker, even if you don't say anything, but if I'm conducting the interview with whoever, John Doe, and I say, hey, John, just so you know, I've got Terry in the room today. Terry, sometimes we talk about medication, it's above my head. Terry's my kind of resident expert on that stuff, anything HIPAA related, she's an expert, whatever it might be. And so if I ever have questions, I always go to her. But I just want to let you know that that's what she's doing in the room for me today. And so now even just the presence of an expert might minimize the amount of garbage thrown your way during the conversation.
Okay, that makes sense. So theoretically, if it's a healthcare professional who's conducting the interview that has a good working knowledge of the space, then they should be on a level playing field. But if you've got somebody maybe with the law enforcement background or HR background that isn't clinical, then think about bringing in some of that. And I would think, depending on where your subject matter expert is sitting too, they could always give you the look like what they just said was
we talked about this a little bit earlier. I think there's a benefit to being a really strong interviewer and investigator. There's also a benefit to having contextual knowledge about what you're interviewing. So I've met plenty of great investigators that are clueless about financial crime, but they're great
Okay.
at maybe crimes against people, like sex crimes detectives, right? Or homicide detectives. But all of a sudden they get dealt with an embezzlement case. They got moved to a different division and they have no idea how somebody is, committing tax fraud because that's not something they've investigated before, but they're a good interviewer. And so it's just understanding in that scope, like not only what's the right way to conduct business, but what are all the different types of loopholes and ways that people can take advantage. And I think in your world, especially, it's so easy for somebody, if I'm interviewing them and I don't have the knowledge, it's so easy for that person to say, well, I did it that way because I was trained that way. It was a busy day. We have an exception to the rule sometimes. When they can give you that, well, I didn't know it was wrong. It's really hard for somebody like me without that specific knowledge to lock them into knowing it was wrong, right? Or to counter
Right.
that. So that's where that expertise can come into play.
Okay, makes sense. Let's talk about empathy, because every conference I go to, when they're talking about doing interviews, is you need to come across with empathy, especially when you're talking about a substance use disorder and it's a disease, and they're not thinking clearly. And yes, they need to be held accountable, but they didn't start out wanting to do this. So I think some of that empathy will play out naturally at the beginning when you're open and honest with them and thanking them. But what are your thoughts on that for this particular subject? Do you think I kind of have my own opinion, but I want to see what you say, because you're definitely the expert. Do you think that increases the chances that somebody is going to admit, maybe not to diversion, but admit that they have a problem? Or does it matter? What are your thoughts?
I think empathy and rapport are foundational for an effective interview. Yes. But let's talk about empathy more specifically. I think one of the dangers people run into is they cross the line from empathy to sympathy, or even empathy to justification. And that's where we get into some trouble. An example of that is empathy is, right, understanding maybe where somebody else is coming from or the difficult situation they're in, but it's not necessarily agreeing with what they did in that situation. And, sometimes we've seen well-intended investigators will start to talk about, hey, I know life's been tough for you, and I'm sure you're under a lot of stress, and we understand why you might have done whatever X, Y, or Z may be. And they're attempting empathy, but they might start to kind of cross the line where they say, and I understand why you may have done this, or it's not as big of a deal as you think. And you start to hear phrases like that, and that's known as minimization. And as an interviewer, especially if you're in a role of authority with your company or organization or law enforcement space, when you start to say things like, hey, it's not that big of a deal, or I understand it's only that one time, the perception of the interviewee is, all right, so maybe if I acknowledge it, I'm not in that much trouble. I'm not going to be in trouble because this person who's a boss or who's an investigator said it's not that big of a deal, or maybe it's just an accident. And if it's just an accident, it's not that big of a deal and only happened once, maybe I won't be punished for it. And so one of the issues there is then let's say they are guilty of whatever it was. They could have an argument at some point that, hey, well, I was told that there's no punishment for this, or the punishment's minimal, right? And then they're surprised, and all of a sudden they lost their license, reported to the board, and they lost their job. The other issue, on more of the extreme side, is that sometimes people will start to admit to things they didn't do because their whole goal is just, how do I get out of the room, right? How do I end this conversation? This is uncomfortable. And if there's no punishment for what I did, then maybe I can just say whatever she wants me to say and leave. So that's where we cross the line. Empathy in itself is really important because people they don't need to feel additionally judged or shamed for what they did. And it's not only empathy for the situation they were in that caused them to conduct whatever poor behavior that they did. I think empathy should also apply to the situation that they're currently in, meaning they're in an uncomfortable, probably in a room with a few people they don't normally meet with. I doubt the divergent specialist or investigator is just randomly meeting with people to tell them they're doing a good job. So it's one of these meetings where you're already walking in like, oh, great, what's this about? And so to me, the real test of a good interviewer is when the person they're talking to shuts down, maybe has an attitude, maybe they're resistant, they don't want to continue the conversation. If we can still approach that with empathy and understand, hey, there's a reason they're not talking to me. It doesn't mean I should force them to talk to me. But if I can say, hey, I understand this is difficult to talk about, or I understand with the three of us in the room, people are sometimes afraid to share information. That's why we're going to keep this as on a need to know basis. Or, hey, sometimes people are wondering what's going to happen next. And I got to tell you that my job is to complete this investigation. And my part of that is to make sure we get everybody's input, including yours. That's why it's so important to us. Right? When we can handle the fact of, hey, I got nothing to say to you, instead of saying, well, you better, because otherwise you're going to lose your job. Instead of hitting it with that, we hit that with empathy and remain patient. That to me is the sign of a really good interviewer.
Okay. All right. Those are all good points. What do you say to the person in this case that, it's diversion and we think they might be taking it for self-use, and they say, I'm not doing that. I'm not doing anything wrong. I'm not taking anything. I don't have a problem. You can drug test me right now.
Well, first, I think it depends on what are you allowed or not allowed to do, right?
Well, yes, exactly. Yeah. I mean, let's take both of them. Let's say that, some hospitals that's part of their process. Every interview they have, it's going to end with a drug test, no matter what the interviewer thinks is going on. It's just, this is their process. There are others that is not part of their process, and they would only do it really if there's cause, meaning I think you're impaired right this moment.
Right.
And so they wouldn't, under normal circumstances, drug test that person in that interview. Not to say that they couldn't if it was offered, but what I often hear is, they seem to be fine. They even said that we could drug test them. So obviously nobody would say to do that if they were going to pop positive on anything.
Right. Yeah, I think so. First, let's just that point, right? There's a lot of times we make these assumptions. The same thing if somebody says, well, just give me a polygraph or a lie detector test and I'll tell you, or just do whatever and I'll tell you. We have a lot of these assumptions that, like, if somebody says, well, I want my attorney, the assumption is, well, they must be guilty. Only guilty people ask for attorneys, which is, if my recommendation is, if you're being interrogated, get an attorney.
Ask for an attorney.
Any police officer will tell you if they're being interviewed by internal affairs, they want their union rep in the room. And so sometimes we make, again, these assumptions based off of, well, then just drug test me anyway. Well, then that must mean that they're innocent, or they're, because who would volunteer for that if they, or maybe it's a bluff. We don't know. I think if I back up to your initial question, I would always rather get information through cooperation versus compliance. That's the ideal situation. Now, it's not always the way that it works, right? Especially in the law enforcement space, somebody may be compelled to give information, give a blood sample, right? Yeah, breathalyzer, whatever it might be. But especially when we're talking the private sector, cooperation versus compliance to me means that person, just like a healthcare professional, a therapist, or a nutritionist, or your doctor your dentist who's trying to get you to floss more often than just the day before you come in for your appointment, would rather use motivational interviewing concepts. So this goal of, how do I get the person I'm talking to understand we want to work through this together? And it's better to hear from them their truth and their information versus they're just doing it because I told them to do it. There's longer impacts to that than just what's immediately at hand. And so I think, again, to the first question you asked me on the podcast is, what is our goal of the conversation? If I can get somebody to acknowledge that they're under the influence today, and that's enough, and that's all we're looking for, then maybe what's the purpose of a long extended interview in this investigation? Maybe you are able to just drug test and be done with it. But if my goal is to see, maybe this person, do they have a habitual problem? Are there other people involved? If they're under the influence and it's because they're using drugs that we dispense, how are they getting that? Who else knows about it? If I'm able to encourage the conversation to continue, I'm more likely to get those details. If I just resort to, well, fine, just test me anyway, and I end the conversation and go that route, the amount of information I'm going to get, I've just minimized that scope. And so, again, in the ideal situation, it's to acknowledge, hey, I appreciate you offering to do that, but right now, my goal is just for you and I to kind of get through this conversation now, so we get as much information as possible to make sure we're here to support you and make whatever changes we need to make at the hospital going forward, or whatever the situation might be. But there might be a circumstance where, hey, we don't care. I've talked to my legal counsel, or you've talked to your human resources partners, and at the end of the day, they said, we're just going to drug test somebody, and if they test positive, they're on the influence at work, that's enough for me. So I think it depends on the context at the origin of the interview.
Okay, but we cannot assume they're innocent just because they offer up a drug test.
No, and just the opposite. We shouldn't assume people are guilty when it's the same thing. If somebody says, "Well, I'm not talking to you unless my union rep is here, or my attorney's here, or give me a polygraph," I swear I didn't do it. I don't think we should make any assumptions of guilt or innocence. The best way to identify if somebody's telling the truth is to get as much information from them as possible, and then compare that to the evidence, right, that we have.
Yeah. That makes sense. But why would somebody offer to take a polygraph or a drug test if they were guilty?
I think for the same reasons that we just came up with, is if somebody offers to take the polygraph and they've realized everybody's initial instinct is, well, they must be innocent. Who else would be willing to do it? They could be that could be a bluff. They could be, what's the polygraph matter anyway? I've also had people who are guilty who have asked, well, show me the video. Show me the whatever. Show me the report. Yep. And I've had people, and I'm sure a lot of your listeners who've done investigations could resonate with this. I had one case many years ago that I'll never forget. Of this guy. It was the same situation you mentioned, but this was just a theft of cash case, and he was just very resistant. I was not good in the interview, and I didn't do it, and so I resorted to this. All right, fine. We'll show him the video. How is he going to? On the video, this person had stolen money out of the register. Before he put it in his pocket, he looked at the camera, and it felt like he winked at the camera, but he looked at the camera and almost smiled, like he knew he was getting away with it. He was wearing the same shirt in the interview that he was wearing the day that he stole on video. And so when I'm playing the video, he looked at it, he goes, "That's not me." And it's the most obvious it's him. He logged into the register. That there's other ways to prove it, but it's sometimes people that we've all interacted with are just going to be so resistant to acknowledge they did something wrong that they'll believe their own lies, and they'll create these kind of ruses that's not me. Show me the video, take the polygraph, and they fail the polygraph, and they'll have an excuse for that. So there's this kind of bluff, I think, that fine, you don't believe me, check it anyway. And I think every person that's listening, I'm sure you have only truth tellers that listen to you. However, I'm sure even in people's personal lives, they've thrown out "Oh, you don't believe me? Well, then fine, check my phone or check my email, or fine, go look there," when they're just hoping the person doesn't actually look.
Interesting. Yeah. Okay. Yeah. Some people are a little crazy. I'll end it with this. This doesn't have much to do with our topic, but this was a pharmacist that I worked with who was different. And she and I had a little bit of I guess you'll say a disagreement. It was in front of people. And so I pulled her aside later and said, "Look, I want to sort this out." And she had thought that I was just really, really over the top rude in whatever I said to her. And I said, "I want to sort this out. If you think I was rude, then, I want to apologize. So let's talk about this." And turns out nobody else thought I was, only she did. But the point of this is she said to me, this was an eye-opening moment for me, way into my adult years, right? To hear somebody say this: "I don't care how many people thought it wasn't rude. I thought it was, and therefore that is the truth."
Right.
I was like, whoa. Right. Okay, then. Yeah. I think we're done.
Right. That's not going to change her mind.
Yeah.
Right. Yeah.
That's right. Yeah.
That's a good example. And because the other thing with, show me the evidence, or show me, if somebody has their own perspective, right. The other concept is they might say, well, then show me the video, or I'll take the drug test or whatever. But maybe either A, they don't think you have it. They don't think that evidence exists, or maybe they've done something else that they don't think that you found out about, right? Often people are willing to almost acknowledge a lesser crime or lesser incident if you think you'll stop looking, right? So, fine, I'll take a drug test or whatever, but maybe if they just focus on that, I don't have to talk about all the resale and redistribution of these people I'm sneaking drugs out the back door that are coming in. And so, there's always always an incentive for something. And I think it's important to realize every person's a little different. So it's hard to apply any one of these rules across the board. And that's why, like I mentioned earlier, to me, the most effective interviewers are the ones that are adaptable and can still approach the conversation with adapting their questions and adapting the empathy in a way that keeps the conversation moving forward.
Yes, 100%. Would you say then you are not a believer of showing any video for anything that you have?
I think sometimes it might make sense. So I'd hate to make an absolute statement, don't ever do it. But typically when we show evidence, I'll just kind of give you this last example, but I did an interview with a guy who was installing credit card skimmers in gas station pumps across the country. So he's stealing via Bluetooth, basically your credit card number. And I asked him, when did he feel the most confident during the interviews or the interrogations with law enforcement? And he said he felt the most confident when they showed him a picture of himself at a gas station at one of the credit card machines, which was the opposite of what I thought, because the research suggests that one of the reasons people confess is there's a perception of evidence strength, right?
Proof.
Right? Yeah. He said that he felt like the investigator, he could tell when the investigator got agitated and got frustrated, which a lot of your listeners could probably relate to because he wasn't getting anywhere. When the detective got to that point, he said to the suspect here, he said, well, fine, let me show you this. And he pulled out the one picture, explained that. And so the reason he said he felt confident there is, that was a picture of him committing a crime. But in his mind, if that's the picture they're showing me, that's probably their best evidence that they had. This guy had been stealing or going to cities across the country almost every weekend to commit this fraud. And all they had was this terrible, grainy still shot of him from a surveillance video. So in his mind, if that's the best they got, I feel pretty good about the 95% of the other stuff I've been doing. They have no idea about.
That I'm going to get away with.
That's not, again, doesn't apply to every case, but I think when we show evidence, it's easy to attack, it's easy to excuse, and we're also showing people, this is all I know about, right? If you're going to show me one audit, one question, one day, maybe that's the extent of what you know. And at the end of the day, the best way to tell if somebody is telling us the truth is if they tell us things that we don't prompt them with, they tell us something that we can go match in the investigation. Whereas if you show somebody something, they just say, that's me, or that's what I did. It's really hard to verify the reliability behind that information.
Makes perfect sense. All right, great. Well, thank you very much, Dave, for your time. I really appreciate it. And there's so much more. This is just barely scratching the surface.
Yeah, well, I appreciate the platform. Interviewing is sometimes people think, they raised kids or were in relationships or interact with people. They know how to interview everyone, but oftentimes we resort to really bad tactics that can cause some liability, especially in the healthcare field. So we appreciate being able to talk about it.
100%. Thank you.